Health after 70 is an adventure, and at that stage, knowing which medical checkups are truly your allies can make an astonishing difference. But did you know that there are tests that, far from being harmless routine, are fundamental pillars for maintaining your quality of life and preventing complications? I'm Dr. Alex Thornton, and there's a crucial truth I want to share with you. Every year, millions of older adults wonder how to best protect their health. And not all tests are created equal. Some are simply vital. What if I told you that investing in the right checkups could be your best strategy to avoid unexpected diagnoses and maintain your independence? It's not about doing all the tests, but about which ones empower you. New analyses suggest that a smart selection of medical tests in older adults can be key to a full life, avoiding unnecessary treatments and focusing on what truly matters. The most important thing is for you, or your loved ones, to clearly understand the difference between excess and smart prevention. In fact, one of these checkups, the one that takes the top spot on my list, is directly related to preventing a disease that, if detected early, can be successfully managed. You won't hear this just anywhere, but the scientific evidence is there, and today I'm going to light the way to better health. In this video, I'm going to reveal the 5 health checkups that every adult over 70 should discuss thoroughly with me or their trusted doctor. These are the pillars for early detection and lasting well-being, all backed by science. And believe me, you won't want to miss the one at number 2. Before we start, tell me in the comments where you're watching from and how old you are. Do you feel like you know which tests are most important for you? Have you ever felt that a test brought you peace of mind and helped you? I read and respond to every comment with personalized advice. And don't forget to like this video and subscribe for more content like this. Now, without further ado, let's talk about the first crucial test. It seems simple, but it's a silent guardian of your well-being. Body, present the checkups, maintaining interest with cases and key data. Checkup number 5. Vitamin D assessment. It sounds simple, a quick blood test. But vitamin D is much more than a supplement. It's an orchestra conductor for your bone health, your immune system, and even your mood. From age 70 onwards, your skin's ability to synthesize vitamin D drastically decreases, and intestinal absorption can be less efficient. But here's what many do not tell you. Vitamin D deficiency in older adults is directly linked to an increased risk of falls, fractures, muscle weakness, and, yes, even cognitive function. It's as powerful a health factor as other habits we already know. I explained that various studies have shown that maintaining optimal vitamin D levels not only strengthens bones, reducing fracture risk, but also improves muscle strength and balance, 2 key factors in preventing falls. And unlike medications with side effects, vitamin D supplementation is safe and effective. I'll tell you about Antonio, a 79-year-old retired engineer who constantly felt fatigued and noticed his bones felt heavy. His routine tests always seemed normal, but he had never had his vitamin D measured. On my recommendation, he had the test, and his levels were critically low. We started a supplementation plan with appropriate doses and medical supervision. 6 months later, Antonio not only felt renewed energy, but his minor joint discomfort had decreased, and most importantly, his risk of falling significantly reduced. A simple blood test for vitamin D is a smart and proactive decision. For people over 70, it's an investment in vitality and autonomy, far more valuable than ignoring a deficiency that can have multiple repercussions. Don't let the lack of this silent vitamin affect your quality of life. But there's another checkup that can protect you from something even more serious: a stroke. Let's talk about that now. Checkup number 4. Carotid artery ultrasound. When you're looking to maintain your independence and functionality, stroke prevention is paramount. Carotid artery ultrasound, which examines the blood vessels leading to the brain, is a non-invasive test that looks for narrowing or blockages in these arteries. But here's the empowering truth. These ultrasounds, when indicated, can provide crucial information to prevent catastrophic events. In fact, in people over 70 with specific risk factors like high blood pressure, elevated cholesterol, diabetes, or smoking, this test can save lives by identifying plaque deposits early. The issue is timing. Important studies have revealed that early detection of significant carotid stenosis in at-risk groups allows for preventive treatments, such as medications or, in selected cases, minimally invasive procedures, which drastically reduce the likelihood of a stroke. This means a significant number of people can avoid the torment of severe disability, thanks to the information this scan provides. Consider Carmen, a 75-year-old active and energetic piano teacher with a history of hypertension. I recommended a preventive carotid ultrasound. The test revealed moderate narrowing in one of her arteries, something she had no symptoms for. Thanks to this detection, we adjusted her medication to better control blood pressure and cholesterol, and scheduled regular follow-ups. Carmen was able to continue her life without worrying about an imminent stroke, knowing she was taking proactive care. The truth is, for people with risk factors, a carotid ultrasound is a powerful tool for prevention, a much more sensible and proactive step to identify risks before they become emergencies. Now, get ready, because the next test on this list is one you've probably had several times, and it's crucial for your daily vitality. Checkup number 3, Thyroid Function Test, TSH. It's one of the most common tests, but its importance is often underestimated in older people who complain of fatigue, weight changes, or difficulty concentrating. The TSH test measures thyroid-stimulating hormone, a key indicator of whether your thyroid is functioning correctly. But after 70, especially, an underperforming thyroid can camouflage itself with other symptoms of aging. The reason? Both hypothyroidism and hyperthyroidism are more common with age and can have a devastating impact on energy, heart, and mental well-being. The problem is that its symptoms, fatigue, mood swings, memory problems, constipation, or cold intolerance, are often mistakenly attributed to age. Studies show that in adults over 70, the rate of subclinical or overt thyroid dysfunction can be surprisingly high. This leads to many people living with symptoms that could be easily resolved with simple and safe treatment. I point out that research published in prestigious medical journals found that appropriate treatment of thyroid dysfunction in older people significantly improves their quality of life, cognitive function, and reduces the risk of heart problems. It happened to Isabel, a 78-year-old retired seamstress. She complained of unexplained lack of energy and weight gain. Her previous doctor had dismissed it, blaming age. When she consulted me, I ordered a TSH test. The results revealed mild hypothyroidism. With a small dose of thyroid hormone, Isabel regained her energy, her weight stabilized, and her mood significantly improved. She felt like new and returned to enjoying her daily walks. If you are over 70 and experiencing unexplained fatigue, weight changes, or memory problems, a TSH test is a safe and smart step. It's a simple, inexpensive analysis that can prevent you from attributing to age problems that have solutions. And now, the checkup you probably didn't expect to see on this list, but it's fundamental for preventing a serious illness. Checkup number 2, Chronic Kidney Disease Screening, Creatinine and Urinalysis. Yes, you read that right. Kidney Function Assessment. A simple blood test, creatinine, and urinalysis is a prudent and essential option after 70, and it should be a constant in your annual checkups. The risks of chronic kidney disease increase with age, and often it's a silent condition. Kidney function naturally declines with years, and common diseases in older age like diabetes and hypertension are the leading causes of kidney damage. If not detected early, it can lead to serious complications. I summarize for you that the balance between risk and benefit of detecting kidney disease drastically changes with age. For older people, medical guidelines indicate that early detection allows for the implementation of kidney protection measures that can delay or prevent progression to kidney failure, avoiding dialysis and transplantation. The case of Pedro, a 74-year-old retired carpenter, is a clear example. Without obvious symptoms, his routine tests during his annual checkup with me showed an elevation in his creatinine, indicating slightly diminished kidney function. Thanks to this early detection, we reviewed his blood pressure medication and provided dietary guidelines to protect his kidneys. Pedro was able to avoid the progression of his kidney disease and maintain a good quality of life, something that would not have been possible without that routine test. The U.S. Preventive Services Task Force and other health organizations recommend regular assessment of kidney function in older adults. For those with risk factors, this checkup is even more critical. It's a non-invasive test, done at home or in the lab with a simple sample, and it detects most concerning cases before they become a serious problem. Ask me or your doctor about these tests because early detection can make a huge difference. And now we have reached the most important and vital checkup for older people. You've almost certainly heard of it. Checkup number 1. Colorectal cancer screening, stool tests, or targeted colonoscopy. These checkups, far from being harmful, are promoted as the most effective way to detect colorectal cancer early, one of the leading causes of cancer death if not caught in time. But here's the shocking truth I share with you. Not all forms of screening are equal, and the right choice for you is key. For an adult over 70, the risk of this type of cancer increases, and early detection through stool tests or, in selected cases, a colonoscopy is incredibly effective. The irony is that, unlike other scans, this screening does have strong evidence that it saves lives. Stool tests, like FIT or FOBT, are non-invasive and detect the presence of occult blood, an early sign of polyps or cancer. If these are positive, then a colonoscopy is considered. For people with high risk or specific symptoms, colonoscopy remains the gold standard for its ability to detect and remove precancerous polyps. Recent studies show that regular colorectal cancer screening has drastically reduced the incidence and mortality of this disease. This means that a checkup that might seem uncomfortable can actually be preventing a deadly disease. I'll tell you about Teresa, an 81-year-old retired teacher, active and healthy. Following my recommendation, she performed her annual FIT test at home. On one occasion, the result was positive. This triggered a colonoscopy, which revealed a tiny precancerous polyp. The polyp was immediately removed. The result? Teresa avoided advanced cancer without having had any symptoms. Experts, including the American College of Gastroenterology, are clear. Colorectal cancer screening is vital and should continue until at least age 75 for most people, and can extend to 85 in individuals with excellent health and life expectancy. If you have symptoms like blood in your stool, unexplained changes in bowel habits, or weight loss, then a colonoscopy is crucial. But even without symptoms, a stool test is an excellent first step to detect problems early. A safe and smart approach is to discuss with me or your doctor what the best screening method is for you. If you feel well, keep up with your regular checkups and get the tests that are clearly indicated for preventing serious diseases. There you have it. 5 checkups that, far from being harmful, are absolutely essential and beneficial, especially after 70. Modern medicine is powerful, and sometimes knowing what to look for is the most important thing. Always ask me, how will this test help me stay healthy? If the answer is clear and the benefits outweigh the risks, It's time to act. And remember, as I always tell you, true prevention starts with your lifestyle, but it's empowered by the right information. Stay active, eat well, sleep soundly, and choose your checkups wisely. Now I want to hear from you. Have you or a loved one felt the peace of mind from a checkup that helped prevent a problem or treat it early? Share your experiences in the comments. Thanks for watching.